Welcome to the Global Code. Ready for tech that reflects the global world? Our podcast goes beyond the buzzwords to explore real world tech solutions for and with everybody, everywhere in the age of AI. I'm your host, Dr. Salima Bimani, the maven of moonshots. And here are my co hosts, Shadan Delaveau, G Force of Talent, and Ashish Pujari, the Master of Engineers. Now, let me pass it over to Shadan to introduce our guest for today.
Salima, thank you so much. Super excited today. We have an amazing guest with us. Kimberly Seals Allers is an award-winning journalist, author of 5 books, international speaker, strategist, and advocate for maternal and infant health. A former senior editor at Essence and writer for Fortune magazine, Kimberly is a leading commentator on birth, breastfeeding, and motherhood, and the intersection of race, policy, and culture. A frequent contributor to the New York Times and the Washington Post, Slate, as well as others. Kimberly has over 20 years of experience as an international business journalist and Wall Street columnist, which give her a unique lens to frame communication strategy with an understanding of business and capital markets. As a director of various on-the-ground community-based projects in several U.S. cities, Kimberly is also deeply rooted in the lived experience of mothers across the socioeconomic spectrum. She brings all of these experiences to bear on her strategic advisement of clients, advocacy efforts, and her vision for a world that supports mothering as valued work. Kimberly is also the founder of Narrative Nation, as well as its first product, Earth, which we're incredibly excited to speak to her about today. Kimberly, welcome.
Thank you. Thank you for having me.
It is absolutely our pleasure. From your amazing bio, you are clearly a person of many talents, and it's hard to figure out exactly where to dive in first. But let's start a bit more broadly. Just tell us, in our viewers and our listeners, what are you working on, and why are you passionate about it? What are you trying to solve?
Well, the problem that I seek to solve is really related to bias in maternal and infant care. We know that people are not being treated the same way, even at the same place. And unfortunately, this disproportionately is leading to adverse outcomes and even death for more Black women than I think it should be acceptable, right? So, this work came out of my own pregnancy journey and my own experiences giving birth in this country, where I did a lot of research and thought that I was really doing everything that I could with the information and data that was available to me to choose a provider and an amazing hospital based on media lists and, again, all the tools that were available. But, walked out of a highly rated hospital feeling very much disrespected and traumatized and wondering, what had I missed, right? Like, was there data that I did not get or whatever? And really, spent some of my early mothering journey blaming myself. What did I do wrong, right? Was there another way of looking at this that I had missed? But what I realized, was that, again, people's circumstances are impacting the care that they receive, right? We know that should not be the case. And so, I created Earth because I wish I had it when I was giving birth, a tool to see how other people like you, particularly for Black and brown folks, are experiencing a provider at hospital as a key data point for provider selection, but also a way to build community and to hold hospitals accountable for their treatment and care of Black and brown birthing people.
Mm-hmm.
Wow, incredible. So you've mentioned so many topics, and there's just so much to dive into. And taking a step back, before we speak about Earth specifically, one of the questions that you said that you asked yourself is this: what did I miss? Again, just going back to your bio, you're clearly a woman of incredible influence, education, with incredible skills around communications, advisement, consulting, all types of things, and still walked out of that specific experience feeling like you must have missed something. Uh, I'm sure that many of our viewers already know that when you take a look at the data, Black women in particular have a very different experience when it comes to birthing and their maternal experiences. And so the data also shows that that is irrespective of wealth, income, socioeconomic status. And this is almost that lived experience of it. Was that something that impacted your perspective at all, as well as the decisions that you made?
Yeah, it certainly did. I think that when I became pregnant, I was blessed to not be poor. I was blessed to be educated. I was literally at Columbia doing my master's degree program. But as you stated, the data shows that these are not protective factors for Black women. In fact, a new report coming out of California a few months ago showed that Black women who are earning more than six figures, right, are actually at a higher risk than white women who did not graduate high school.
Mm,
And their babies are also at a higher risk. So, to your point, you may think that your education and your resources may be protective,
mhm,
but they actually are not. And so, this is an additional layer to the problem because we can't kind of educate our way out of it, right? We can't try to, upskill people and think that because they're in certain fields, we've had traumatic experiences from literal OBGYNs giving birth at their own hospitals, right? And so I think this really underscores the history of using what really we now know was bad data, which sought to make Black women the problem, saying that it was about prenatal care, it's about pre-existing conditions and high blood pressure and diabetes. And I'm like, well, white women have diabetes and high blood pressure too, but somehow they get to survive childbirth at, a different rate than Black women. And so I think the lived experience data has helped really quiet some of the kind of the false facts that have been circulating in this field for a long time and have allowed us to get to a much deeper and, for me, richer and more honest conversation about the way that who you are is impacting care.
And one of the things that actually is standing out for me, Kimberly, is that you're talking about a problem that is embedded within a history of systemic racism and inequity for Black people and Black women in particular within the healthcare system. And the sort of the looking at maternal care specifically is sort of an effect of this like institutional challenge that has been ongoing and historical.
So true. Like, we can't look at healthcare in our country at any level without kind of looking at the history of healthcare in this country, the ways that hospitals literally weren't built for Black people. We had to build our own at one point because we were not allowed to receive care in certain places. We look at the history of someone like Dr. Marion Sims, who has been lauded and received many accolades as being the father of gynecology, but his whole science and all of his experimentation was on enslaved Black women, clearly without their permission. Now we know without anesthesia. And so we can't really ignore the history of certainly, medicine in this country and most particularly the OBGYN fields without acknowledging that much of this was built literally with Black women's bodies. And then when we think about systems like literal facilities and systems being built without the inclusion of Black people. And so we can't really address this issue without understanding that historical context. So important.
Yeah.
great.
You decided to do something about it, and I love all the things that Shadan talked about that brought you to this. So, tell us more about this earth that you've created, and I love the name. Can you tell us about the name? What is it's a gorgeous name, by the way. I love it. Makes me feel like I wanna go and be, like, in like, go give birth in the forest. That's what it makes me feel like.
Well, we love the name Earth is like the word birth, but we dropped the B for bias, so it's spelled IRTH. But certainly we want the language and the sound of Earth to give you really other feelings around what it means to be a part of, you know, um, a mothering community, what it means to kind of be in connection with, nature and everything else. So we created Earth, which is like the word birth, but we dropped the B for bi, so it's IRTH, really as a first of its kind Yelp-like platform designed just for Black and brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. So our vision for data is all about giving it to the community first, and letting this be a unique and really a never had before provider tool. Again, what if I had the ability to look at reviews from other Black women or people who were like me, perhaps because of at that time of my life, I was not yet married. Um, at that time in my life, I was in grad school. So I was on student insurance. And so I was an unwed Black woman with basic insurance, right? And so we know that that impacts care and what it would have looked like for me to look at reviews from people who were more like me. And so we really provide that service to the community. And then on the back end, we turn our reviews into data to work directly with hospitals, payers, and providers. What can we learn by listening to the lived experience of Black and brown folks and using this as data? I'm really proud that we're literally building the first national database of BIPOC experiences of care, right? In maternity and infant care being really, really important as how we kind of center those who are most burdened by this issue as the way forward. And I think that's an incredible model that we've seen applied some places and probably needs to be applied a whole lot more places, but certainly something that we're proud of and excited about using that as a way forward.
I love
When
that.
you speak about this data, it was so interesting and compelling because when we were originally having this discussion around the global code, the initial ideas were, how do we ensure that this story and the importance of inclusive data, how do we ensure that we're telling that and visibilizing that for people? And so that whole concept of Earth, not just giving people that platform to speak about their experiences, but then using the data to hold institutions accountable and creating that accountability for these traditionally marginalized voices absolutely resonates.
I kind of want to tag along on that and like scope it to the aspect which I found interesting was you talked about, we have the data, but you also talk about Earth working with the community rather it being for the community. So how does like data along with that mission, like how does that look?
That's such a great question. I mean, we've been very intentional, and the language that I use is about decolonizing data, right? Because we know that many data structures have actually been oppressive to Black and brown folks. We can look at many academic models. We can look at, again, medical research, right? Like there was literally research data that said that Black people didn't feel pain the way other people did. Like that was considered legitimate data that someone created and it became a fact, right? And so if we're not asking deeper questions like who's generating the data, who is it for, who's behind it, like just all the questions, that's really important. So that's one thing that we try to do. And I would say like for us, the beginning of decolonizing data is data that's accessible for all. Right. We also know that data often exists in our country in many places. I'm sorry, not in our country, but data often exists kind of in hidden websites. And many times data is actually created for other data people to impress other academics. It's not for the community. And we have been very clear that our data is for the community first. In fact, in many of my grant proposals, the community will get the data before the funder does. I'm very serious about that. And then, of course, the most important data, which is the data of the experience of other people like you, becomes available in the app as quickly as our volunteers can read and approve the review, right? So that for us right now, maybe about 7 to 10 business days that it takes for the review to be approved by our volunteers and then released into our searchable database for the community. So I think that's important. This other thing that I want to say, and I say this to my team all the time, is on the back end, we're working with hospitals. They would love to access our data. And if I would just sell our data, I would probably never have a funding gap, right? We're a nonprofit and raising money is important. But the only way to access our data at this time is to sign our very lovely legal document that our lovely lawyers created, which says you're going to do the work to improve your care based on the data that you receive. And I think this is also the key piece. There's been lots of data, but zero accountability. And I've been deeply concerned that this question, because people always say, we need more data. Do we? Sometimes it becomes a ruse for inaction. And so just this idea that we need more data, I don't know if that's always true. It's becoming a thing that people do because they don't want to deal with an issue. And so for me, I'm like, we don't need any more data. We don't need any more specifically that type of data. Like we know Black women are dying. This has been documented. We know the whys. What more do we need besides data that can actually address the issue? So we're very focused on data that addresses the issue, not doing problem identification anymore, because I don't understand why people still think that's necessary. And then the last thing that I will say about data has been very interesting is that when you center community voices, right, it is a challenge of power. And I think this for me is the connection, the intersection between technology and data. That it's not about just data for institutions, right? It's about data that the community benefits and drives impact. So hospitals all the time when I meet with them, usually because we've seen something in our reviews, we are very active on social media. We're active in digital marketing. We're active in terms of how we activate local birth workers who know about Earth and are getting their clients and families to leave reviews. But when I meet with a hospital and, they tell me no, I get a lot of no's when I'm saying, hey, you might want to come into our improvement plan and think about how you can improve your care. They tell me no. And I'm like, okay, well, let's pull out your Earth app reviews. And then I will begin to show them. And the look on their face, I tell my team, it's like my favorite screenshot because they're like jaw drop. Like, I mean, it's crazy. And they're like, how did you get that? How did you get that? The idea that I have data on them
Right.
without them is so mind boggling to them, right? And this is the problem. They think that I needed their permission to get data from my community. And I find that so funny, but it's actually sad, right? Like you should see the looks on their faces when they can't imagine that we didn't ask permission to get feedback from our own community about their care, right? Like mind blown because they've been centered for far too long. So when we're talking about, for me, decolonizing data, it's also this idea about who owns it, right? Because they want ownership over everything. And they don't want the community to have it, which is ridiculous and, really disrespectful and something that we don't do.
I love what you're saying about, I think you're also challenging this idea that empirical data is the data. Like, as opposed, because I think what's happened to a lot of people of color who participate in academic studies or whatever it may be, when it comes to data, our data has always been viewed as subjective data, as opposed to, and there's nothing wrong with subjective data, but in relationship to sort of how academia has thought of data or how science has thought of data, it's always been our data is less objective and more subjective and therefore not real, therefore not factual, therefore, biased in some sort of way. And I think what you're doing is I hear you pushing against that to say and actually say, hey, in fact, people own their experience. It's actually their experience. And by the way, you can learn something from that because you're supposed to be servicing them. That's what I'm hearing you say. And I think it's an amazing sort of testament to how you have redistributed power.
Yeah, thank you for that. And I think for me, data is power, right? And, we want to put that data back in the hands of the people because it has been kind of the chokehold and the expectation that the power of data is being held by academic institutions, hospitals, whatever it is. And I think this goes across multiple disciplines. Um, and on the other side of that for us is challenging kind of long held, kind of ideas about data, whether it's empirical or qualitative or quantitative. And two things I wanted to say there is that, when we only focus, and I say this to hospitals all the time, in this particular case on clinical outcomes, right? So yes, we're looking at mortality, morbidity, hemorrhaging, et cetera, et cetera. But what happened was hospitals want to say, well, we haven't had a maternal death in a year or 2 years or 5 years, as if not killing us is the only goal. And I'm like, just because you didn't kill us or not kill us doesn't mean we have the experience that we deserve. But when you only have clinical outcomes, then you get to try to look at those as if that's the whole picture. I'm like, no, 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 no. There's a whole, just because we didn't die or nearly die doesn't
Right.
mean that there's not important data. That doesn't mean that that's not an important data point. And all of that data is being missed. And there's a whole spectrum of trauma that people are holding. Just because they didn't die doesn't mean they have the experience that they deserve when we're only focused on those kind of clinical points, which has also been kind of where most medical research is done. And then I will say on the other side of that, because also in my field, there's a lot of focus on evidence-based maternity care, evidence-based this, evidence-based that. And I keep asking evidence-based on whom?
Right.
Who is this evidence based on? Because it
Right.
didn't include Black people.
Right.
So again, problems with the data and the evidence base that didn't disproportionately include the people who are now disproportionately killed by the same system. Something's not right there. Something's not right there. So we look at data and evidence as being over-indexed by the people who are being disproportionately harmed. So I don't really want to hear about your evidence-based stuff unless you can prove to me that evidence is based on the Black people and the brown folks who are being disproportionately harmed by the current system that was built on data, apparently, as well. So not very impressive.
There were two things that you talked about previously as we were when we first met you. And the first was you really hopped on this idea of Earth being designed with the community instead of for the community. And that was something that we took away as being, again, just very poignant. Wondering if you could talk about that process. How do you, as you're thinking about a product, how do you ensure that it's something that's being developed with the community in mind, as opposed to something just being designed for the community to use?
Yeah, I think this is so important because as a person who's come to tech as an outsider, right? As you mentioned, I'm a journalist by trade. So I have a passion for storytelling and a belief that those stories have power to change, whether that's literal storytelling that we do kind of through the Birthright podcast, but also through turning stories into data on Earth that, I come to this with a very different lens. And one thing that was very concerning from the product development side, as I was in different accelerators and incubators and all the betas and aiders for this field, that this idea, and most of the ones that I were in were either healthcare related or something around disparities, right? But even in these spaces, this idea of kind of getting feedback from the community was a very low bar, very low bar. And it was a little scary. So one of the things that was important to me was like we would really design Earth with community. So that meant that before we wrote literally one line of code, I got a grant, which allowed us to be on the ground in community for 18 months. We had 5 pilot cities. And at that point, we had folks who were out literally knocking on doors, literally outside of churches. I was outside of all the churches on the ground, 5 cities, asking about our product, right? Like our concept. Do we need this? Do we want this? What are the questions? Questions about the questions. We have focus groups, but we literally went to the people. And this was really important because through this process, we had over 1,000 folks that we touched in this idea of what Earth needed to be and if Earth needed to be, right? Because again, I think people come up with their great ideas and they go to the community for validation, but very few are willing to say, hey, the community doesn't actually want this or need this, which is also an important thing that needs to happen. And so we did that process. And then we created a community advisory group that kind of led what we were doing as we decided to move forward with the product to be a part of how we created our user experience. I'm also really proud that Earth was originally built by a team of femmes of color. Like that was really important to me. I built that team by hand myself, just trying to make sure that we were rooted in the lived experience down to everyone who worked on the team, right? So I think that's really important. And unfortunately, what I see is that some folks, they have this big idea. They feel like they want to, as an afterthought, get community feedback, figure out what the Black and brown folks think, and it becomes an afterthought. And I find that incredibly disrespectful to Black and brown communities and something that needs to be addressed, I think, in product development in general. And so when I say there's a low bar, like people who said, oh, I spoke to 5 people and that was acceptable research for people to move forward. I was like, 5 people, So it has seemed that in many of these places, the bar for what is considered community feedback or whatever for product development is very low. And I think that's only going to be harmful to do that. Other thing that I will say was also included an 18-month process was a lot of time figuring out how do you build technology that is safe for people of color. We know that Black and brown folks in Earth may be leaving a traumatic experience. We also know that hospitals, may want to sue me or my company for revealing the identity. Like there were real protections, and really want to shout out the Ford Foundation for giving us a lot of expertise about what it means to build technology for communities of color and think about safety. because I don't think folks are being that thoughtful in their processes, and it was really necessary.
Mhm. Yeah, and I think what maybe what you're describing too is the vulnerability. I mean, it's one thing to share your experience, but it's another thing for that experience to get shared to institutions that you might find yourself vulnerable to. And so I actually really appreciate that what you're also laying out is that, product inclusion and product design requires a lot of thoughtfulness, it requires a lot of trust building, and then it requires sort of some level of reciprocity in which people feel like by doing this, I'm actually getting something out of it that's going to come back to me in a way that's not going to make me vulnerable or cause harm.
Can I bring this back a little bit to the tech side, if you don't mind? Because some of the things you brought up uh, kind of made me think about like the tech side of things. So in terms of like data points that you collected that made you believe that, hey, this is something that people want out there. I'm just curious to know like what were what were some of those data points?
Yeah, I think one of the most compelling first of all, the first thing that we knew was like everybody had a story or knew someone who did have a story, right? And so the foundation of validating Earth as a concept was that it is a experience gathering platform, right? And so we just needed to understand the breadth of experiences that was out there and then how do we capture them. So some of the things that were really important from our kind of initial pilot period were around, would you have preferred, like, would you have wanted a place to see where others like you had previewed a provider? Did you ever ask someone for a referral, right? Because ultimately, that's what we want people to do. We saw a lot of data showing that Black people were very scared about going to a provider in this field, and they were looking for trusted providers. They would use informal networks, such as, friend groups, churches being another one, just asking around locally. The other data point that was very interesting to me that led to a very unique product development was that every place that I went, doulas and birth workers, doulas are kind of trained birth professionals who support parents during pregnancy and childbirth, but they always knew the safe places and the dangerous places, but they would kind of whisper it to their clients like, no, 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 don't go there, go there. Don't do that, do that. It was like I call it the Underground Railroad for birth. It was
For sure.
crazy. And I'm like, okay, how do we lift this up? And so Earth accepts reviews from doulas, right? We accept reviews from the birthing parent, from fathers, but from doulas as well, because we want them to contribute to this movement to keep Black birth safe. And so, but these were things that we were learning. It was like people were looking to data point on who actually knew what were safe places. Would people be looking for a resource? How were they finding safe places currently? And would they be interested in using a platform? Also, I do want to note that, Earth is, to Salima's point, for me, our competitive advantage is trust. There is nothing that prevents, theoretically, a Yelp from doing what we do. In fact, Yelp tried. It was supported by one of our funders who recognized that actually people don't want to talk about their births where they talk about their burrito. So it didn't work. And then one of those funders became our first funders, right? So again, this idea of people wanting a safe space. All of Earth's reviews are anonymized, and I think that is something that's really important. Like, could another platform provide the safety? We are a nonprofit, so we're not as tethered to some of the purse strings that come with healthcare, which really run rampant in many areas where hospitals are putting out big money, right? So I think that these are some of the things that we learned through that process. But we knew that people wanted a safe place to learn where they could go that other people thought was good. And that there were people who knew that also needed to contribute to the platform.
How are you users responding to I'm just so curious about the community folks that you're working with and that that your technology is for. Like, how are they experiencing it? What are they saying?
Yeah, our community is really excited about Earth. I think that one of our challenges is balancing what we know to be their excitement about Earth with their bandwidth, right? And so I think that when people think of it, like we always say Yelp-like, because Earth is not just a free-form commenting space. We have to ask structured questions because we need the question to generate data. So, trying to get people to answer questions in a structured way is a very interesting user experience challenge, helping people who we know are already burdened, with life and with issues to take the time to value their story is also something we spend a lot of time making sure that our community is supported in doing that. But people love what Earth is doing, and they really love the hospital accountability. Um, they enjoy being able to help another family, right? Like leave your review. We always say, search reviews for yourself, but leave a review for another mama or another family, because we believe that we can save ourselves out of this mess. And that Earth is just one of the many tools that can help us do that. And so that message really resonates with people, and people are excited that we are taking on a system that, really continues to be disrespectful, and quite frankly, deadly in its treatment of Black women in particular. And everybody's had enough. Everybody.
Mhm.
Kimberly, this has really been incredible. As we come up on time, I just wanted to give you the opportunity to kind of give a call to action for everyone that's watching, everyone that's listening. What do you want them to do next? How can they assist?
Well, yeah. I mean, the first thing we'll always ask everyone to do is if you know someone who has given birth, in the past 5 years, please download Earth and leave a review, right? We accept reviews of prenatal experiences, your birth experiences, and pediatric appointment up to the baby's first birthday. So building our reviews database is always our first goal. But please spread the word. If you could share about it on your social media, I always say, if you have a mother, then this issue should be important to you. So this is not just about people who are giving birth. It's about all of us taking, issue with this approach, and this crisis, and using whatever platforms we have to do that. Earth, we are a nonprofit. So if you can donate to support our work, please visit earthapp.com and look at how you can support with resources. I love talking to tech folks because we've really been supported by technology people who have skills that they're saying, Kimberly, I'm great at product management, or I know AI and I would love to volunteer time. I take all of those emails. So for all the tech folks who are looking for a place to have, meaningful input of their skills, we would love to have you.
Mm.
Whatever time you could volunteer or offer to our work, we'd be grateful for that. And just follow us on socials, right? Like just be an amplifier and supportive of the work. Um, and yeah, I think those would be my asks. Was that enough?
I think that's great. And listen, clearly you got me. For full transparency, I'm on the board of Narrative Nation, which is the parent company for Earth. So it's been an amazing experience, and absolutely encourage other folks to get involved as well.
Can I jump in really quick? Because
Yeah,
we brought
please.
in AI over here. How do you see AI like impacting, either positively or negatively, whatever you're trying to do here?
Well, we know that AI has a function to help us learn more about our data. So we've been mostly focused on what it can do for us in the back end, like how we can more quickly, one, identify issues, how we can more quickly analyze our data, right? I want Earth to be an early warning detection tool so that when we're seeing, let's say, a hospital that's getting a lot of reviews where people are saying that their pain levels are being dismissed or certain things that we know are negative practice behaviors, how do we have a backend system that helps kind of generate that in terms of helping us be aware of it? I do believe that Earth has the power to be predictive. This will be a game changer. When we can actually begin to create the technology that allows us to create scores and let folks know, like, this may be a harmful place. So many potential opportunities there that we're excited about. We're also looking at blockchain development around allowing people to benefit from their own data. As we work with hospitals, we want our community to benefit and be aware of when their data is being used, and letting them have direct access to benefiting from that. So there's a lot of new technology stuff that I think that we have a great potential to benefit from. And we're excited about it.
Well, you, I think, are changing the game because something that you told us early on when we first met was that, you're not just trying to solve an individual problem, you're actually trying to change the system. And I think the way that you're using technology to do that is a great example of how, um, you know, we should be using technology responsibly. We should be thinking about its potential impact and helping us solve really deep-seated, long historical problems. And just in what you talked about with AI, the potential to sort of accelerate certain aspects of what you all are trying to do. We are so incredibly grateful for you. I'm so incredibly grateful for you. I just gave birth like 2 years ago, and I had an absolutely terrible experience myself, both during birth and post-birth, and so, I find inspiration in what you're doing personally, and I think you're a role model for so many women of color, and for communities of color, so thank you so much for the work that you're doing. We deeply, deeply, deeply appreciate it, and we wish you all of the success, and we're there to support you. I know Shadad's already on board, but get me on board, get Ashish on board, get us all on board. We're coming.
I'm ready for you. I will get you on board. Remember, you said that, and it's
I will.
recorded.
Thanks, Kimberly. So that was an incredibly inspiring conversation with Kimberly. Yes? Yes.
Incredible.
100%.
Incredibly inspiring, yeah. Um, so this is our, post-interview jam session where the 3 of us, talk about everything that we heard and we learned and any insights that we have. So let's get going. Shadan, Ashish, any big thoughts right off the bat?
If you don't mind, Shadan, I'll jump in. So, what really stood out to me was the building with the community piece where she was talking about, anonymizing data, because that looked like Yelp had an issue with
Mhm.
with that specific thing, right, where people would not trust their data on the platform. The thing, the area that she mentioned around making sure that people who share that information also benefit from it, like that's something that's like incredible, and I'd never really thought about it, because when you think about review platforms, you think like, okay, we put our data in and we use the platform and that's it, right? Like that's where the relationship ends. But if there is a if there is like a post sharing incentive out there, I feel like it makes people more likely to be more involved in the mission.
How I mean, as an engineer, can I call you an engineer, Ashish? Yes.
Yeah, sure.
As our master of masters of engineering, I mean, when you hear that as an engineer, what goes through your mind? Because you're saying that this is something that's unique, I think is what I'm hearing you say.
Yeah, I mean, I'm sure we have all been using some sort of review system, right, for hotel check-ins and travel bookings, and it's always like, yeah, do you trust the people who put the info out there, because there's a lot of fake reviews that people put in.
Mm,
Then there's like, okay, if I share my genuine feedback, like it's hidden in those thousands of feedback providers that
mhm,
are not really, or maybe fake, right, or maybe purchased, like you don't know. And if
mhm,
somebody uses my information, like I mean, of course, yeah, I don't expect much from like a restaurant review, but things like personal health information, like if somebody uses that and uh, benefits off that, and some of it, if it ties back to me, I think that's a big motivator for like people who are actually sharing their information. So that's how I kind of think about it.
mhm. Shadan.
Yeah, no, I think that that's awesome. I think for me, one of the things that really jumped out was just the whole concept of accountability. And she touched on it multiple times, but
Mhm,
really not just data for data's sake, and kind of getting into this almost this analysis paralysis. And I can't remember, I wish I could remember the exact phrase she used around using data as an excuse to not act, and that
mhm,
search for data as a reason to not act, but being intentional with hospitals and hospital systems to ensure that to get access to see this data, there has to be a commitment on the front end to not just engage it, but to act on it. And I think that that's incredibly powerful, especially when you think about the substance of the data and what we're actually talking about. When again, in the earlier conversations around the podcast, we were talking about how do we make data not just a number and not just information, but really how do we tie it back to actually being representative of humans and people. And I think that that's one of the ways that someone is doing that, and that Kimberly has really nailed this to ensure that before people even see it and have the opportunity to engage, there's a realization and a commitment to be genuine with how it's being utilized.
Yeah, and I love what both of you are saying, because both of you are talking about different aspects of the product journey in a lot of ways, but and not to make this abstract by talking about it as like a product, but it is a product.
Mhm.
But I think what's most important for me underlying all of it, and you both are touching on it, is that she is really describing a deep intentionality around the beginning of the process of defining a problem, all the way to what then the solution does, not just for people individually, but how it actually holds, to your point, accountable a system, but also challenges the system to change itself. That is really unique. It's compelling. It's a very compelling story, and a very compelling example of how responsible technology can be built end to end. And I think that is incredible. Like she's doing something that I think is setting. I mean, she's, for sure. I feel like she was saying that, hey, we are trying to make our mark on the sort of world of healthcare through technology. But I also think she's making a broader mark around how we build technology ethically and responsibly and with community. And that is something I think that many tech companies and organizations and leaders can learn from.
Couldn't agree more. Couldn't agree more.
So, thanks both for this. This was amazing. And I'm looking forward to the next one.
Thanks.
See you all
See
later.
everyone next time.
See y'all later.